Hey guys, so I'm back home from surgery. I got home maybe a couple hours ago. Um, the doctor said the surgery went well. She told my friend who was with me at the time that it went well. I didn't get to see her post-op. Just to kind of go through what happened today, I got into the hospital, did a lot of paperwork for admissions, and ended up uh, getting sent upstairs where the nurses checked my vitals and drew some blood for testing before surgery. And I also had a PT there, a PT woman come and kind of go over my crutches and how to walk, even though I've been walking with crutches the last couple weeks. And after that, the doctor came in, drew a little marker on my knee. Anesthesiologist came in, just kind of went over briefly what we were doing, and I was off into the surgery operation room. Basically, when I got in the operation room, they gave me a little bit of anesthesia, made me feel pretty loopy, feel pretty good. After that, they applied the nerve block, which they did through like the groin area. And then after the nerve block was done, then they put me completely under. Next thing I remember, I was waking up in the recovery room with the nurse asking me to drink some water, asking me how I was feeling. I actually didn't feel that out of control or loopy. I thought maybe it was going to be really crazy, but I ended up being fine. My leg was completely numb. I did feel my toes, and I still do. However, the rest of my leg still is very numb. They had me drink, a couple glasses of water before I got up. Then I was made to go pee. They said sometimes that's like an issue with people after they've been put under. Once I went pee, I kind of got dressed, got wheeled out to my friend who was there with me. He pulled the car around. I got in, got home, and I ate. They told me at the hospital that eating might and most likely would cause some kind of nauseous reaction, but I haven't had that yet. I ate some pre-prepared soup that I made. I ate some fruit, and I ate like a superfood green smoothie that I bought right beforehand. As soon as I got home, I also took one of 3 antibiotic pills that my doctor gave me. I'm supposed to take one every 6 hours, so I'll take the next one when I wake up, and then one more during the day. And that's just to help stave off any kind of infection that might happen. And I also took an aspirin as soon as I got home, which would help with potential blood clots. And I also took a couple pills of like a natural anti-inflammatory. I think it's made up of turmeric, ginger, black pepper. So I just want to start loading my body up with a lot of good things, a lot of anti-inflammatories, a lot of things that are going to keep the swelling down. The most important thing that I've been doing since I've gotten home is I started icing my knee. If you look and see, here's the ice machine that I got. So far, it's been really interesting. I can't feel my leg, so I don't know if it's doing a good job or not. I do feel that it is very cold. I put a couple of, my friend AJ, put a couple of frozen water bottles in there, in the cooler chamber, along with a little bit of water, and I mean, I can feel it. It's very, very cold. And I put it on my knee with a little bit of, with the bandage still on it. I am in my knee brace. Right now the knee brace is unlocked to allow the icing, but I am kind of just waiting to see what's going to happen when the nerve block wears off, and supposedly, you know, it starts wearing off between 8 and 24 hours, kind of gradually. So we're coming up on, I think, 7 hours now, so it's gonna start wearing off soon. Anyways, I just wanted to give a quick update. I'm gonna start taking my pain medication right before I go to bed, was what I was recommended, and hopefully I get some kind of sleep tonight. And when I wake up, I'll take my antibiotic, and I'll also take my second dose of painkillers. Other than that, I just wanted to check in, kind of tell you how I'm feeling. I'm in really good spirits, but I hope I can get some sleep tonight. It just feels so weird not having any feeling in your leg other than just like your foot, you know. Anyways, good night, and I will talk tomorrow.